Okay, moving right along, continuing on with respiratory system disorders, we're going to start with obstructive lung diseases, cystic fibrosis, and lung cancer. So, cystic fibrosis is a genetic disorder. It's an inherited genetic disorder that's located on chromosome 7. And there's tenacious mucus from the exocrine glands. That's important to know. Primarily, the effects are seen in the lungs and in the pancreas. In the lungs, the mucus obstructs the airflow in the bronchioles and in the small bronchi. There could be permanent damage to the bronchial walls. And the infections that are associated with TB are common because of the stagnation of the fluids that's accumulating there. They commonly are caused by Pseudomonas aeruginosa and Staph aureus. The effects on the digestive tract, there's typically meconium ileus in newborns, which is blockage of the small intestine with mucus. The pancreatic ducts often get blocked, obstruction of the bile ducts, and the salivary glands are often affected. And when you get the blockage of the pancreatic ducts and the bile ducts, then think of what's happening. You really don't get the breakdown of the nutrients, because what about the proteases and the carbohydrates and the lipases and then the bile to break down the fats? So there's typically delayed growth that's often seen with this due to the malabsorption of nutrients or the decreased breakdown of nutrients for absorption to take place. There is an impact on the reproductive tract affecting both male and female. For the male, there's an obstruction of the vas deferens, and in the female, obstruction of the cervix. The sweat glands are also affected. The sweat has a much, much higher sodium chloride content, so they become very, very salty. So here, if we just look at this flow chart, we look at this autosomal recessive disorder that impacts the exocrine glands. There's an excessive amount of thick, sticky mucus that can obstruct the ducts of the exocrine glands. So we see that it can affect the lungs, the digestive tract, the reproductive tract, and the sweat glands. In terms of the lungs, it will obstruct the airways, and there'll be frequent infections due to the stagnation of the thickness, and it creates fibrosis and can create a right-sided heart failure called cor pulmonale. In terms of the digestive tract, newborns can get meconium ileus, which is when there's an obstruction in the intestines. Now, there could be an obstruction of the pancreatic ducts or an obstruction of the bile ducts in the liver. So both of these are going to result in malabsorption, malnutrition with delayed growth. So you can end up with biliary cirrhosis, and you can get fibrosis of the pancreatic ducts. Now, this can result in not only malabsorption, but can result in diabetes mellitus as well. In terms of the reproductive tracts, it can block the sperm entry, so it can affect the cervix, where there's a cervical mucus plug that forms, and it blocks the entry of sperm, so it creates fertility issues. And obstruction of the vas deferens that blocks the sperm flow. So both of these can create infertility. In relationship to the sweat gland, there's excessive sodium chloride content, so there ends up being an electrolyte imbalance and dehydration. The meconium ileus, that's the bowel obstruction that occurs at birth. We talked about the salty skin, and that may lead to performing the sweat test and diagnosing cystic fibrosis, where people become sweaty, and if they taste their own sweat, they'll just go, whoa, this is excessively salty. Signs of malabsorption, there could be steatorrhea and abdominal distension, chronic cough, frequent respiratory infections, and these can tend to increase over time the longer they have it. And then also the failure to meet the normal growth milestones as a result of malabsorption. The diagnosis of CF, cystic fibrosis, there's genetic testing, the sweat testing, they can test the stool, they can look on the radiograph, there's pulmonary function tests, and even blood gas analysis. Treatment is really an interdisciplinary approach. Replacement therapy of the pancreatic enzymes, so there are digestive enzymes that are available. I have many of my patients utilizing them, even patients that don't have cystic fibrosis, but they're showing signs of either malabsorption or poor digestion. People that have atrophy of the stomach lining or insufficient pancreatic enzymes and gallbladder enzymes. Also, well-balanced diet and carbohydrates, proteins, and fats. There's chest physiotherapy to try and break up a lot of the mucus plugs that are there. Bronchodilators, humidifiers, and moderate exercise is helpful. Okay, let's look at lung cancer, which is the third most common cancer in the U.S. And this can be primary or secondary metastatic. Secondary metastatic cancer is common due to the venous return in lymphatics that bring the tumor cells from many distant sites. Males have a higher incidence than females in terms of lung cancer, and cigarette smoking is the major factor in the development of primary lung cancer. Okay, bronchiogenic cancer or bronchogenic carcinoma. It's the most common type of primary malignant lung tumor, and this one arises from the bronchial epithelium. That's important to know. There are different subtypes. There's squamous cell carcinoma, there's adenocarcinoma, there's small cell carcinoma, large cell carcinoma. So let's take a look at the squamous cell carcinoma. This one develops from the epithelial lining of the bronchus, and it begins at the hilum. The hilum is that opening or the gap inside the lung where the artery, the pulmonary artery and pulmonary veins and the lymphatics travel through. That's called the hilum or the hilus. Adenocarcinoma. The adenocarcinoma is from the glandular tissue. Remember, adeno, the glands. And they're both, whether it be an adenocarcinoma or the bronchoalveolar carcinoma, they're both found in the periphery, the outer portion of the lung. And they're less symptomatic, and they're difficult to diagnose early on because they are less symptomatic. These are a little bit more aggressive. The oat cells, there's small oat cell and large cell carcinoma. The small cell is rapidly growing. They're located near the major bronchus, and they're invasive, and they tend to metastasize pretty early. The large cell is found in the periphery of the lung, and they contain large, undifferentiated cells. And they too can metastasize pretty rapidly. The changes, well, first metaplasia secondary to smoking or chronic irritation, right? So metaplasia. The change in the tissue type or the cell type is reversible in the first stage if the irritation is removed. As the time progresses, that normal epithelial lining, which is the pseudostratified ciliated columnar epithelium, they start to die off. And then they're replaced with different cells. Dysplasia starts to take place, or carcinoma in situ can develop. Here's bronchiogenic carcinoma that we can see here. The lung tumor effects, we have obstruction of the airflow into the bronchus, so we know that there's going to be abnormal breath sounds and dyspnea. There'll be inflammation and bleeding surrounding the tumor, so there can be cough, maybe there's blood in the cough, hemoptysis, and there could be associated secondary infections due to the bleeding around the tumor. There could be pleural effusion. which is edema and watery-like substance around the lungs. That's called pleural effusion. Hemothorax, which is blood that's surrounding the thorax, the lungs, or pneumothorax, which is air that's surrounding the thorax. And then the typical systemic effects of cancer that we're all familiar with at this point. The etiology of lung cancer, cigarette smoking is the major factor, whether it's first-hand smoke and even second-hand smoke. Second-hand smoke has been implicated in a number of cases. And then there's occupational, just exposure to certain chemicals, silica, vinyl chloride, asbestos, all of these are linked to lung cancer. And some of the early manifestations, again, persistent productive cough. It can be seen on an x-ray. Hemoptysis, coughing up of blood. There's pleural involvement, chest pain, hoarseness of the voice. The face or the arm, if the lymphatics, if it's obstructing any of the lymphatics, they become, remember that lymphedema. Headaches, difficulty in swallowing. Atelectasis, which is non-functional alveoli. There's no air, so it's non-aeration. And then the systemic signs we know, it's weight loss, anemia, fatigue, this combination, unexplained weight loss, anemia, and fatigue. The signs of metastasis, it's bone pain, and usually it can be worse at night. And there could be associated cognitive deficits and motor deficits. The diagnostic tests are the specialized helical CAT scans and MRI, chest radiographs, bronchoscopy, and biopsy. In terms of treatment, there's radiofrequency ablation, which is great for small singular tumors, surgical resection or lobectomy, again, good for localized lesions, and then chemotherapy and radiation. And there's a newer type of treatment that's called photodynamic therapy. This is kind of interesting. It's a treatment that uses this drug that's called a photosynthesizer, or photosynthesizing agent, and they use a particular frequency of light. And when the photosynthesizer is exposed to a specific wavelength of light, they produce a form of oxygen that kills the nearby cells. The agent is absorbed by the cells all over the body, but they stay in the cancer cells longer than it does in the normal cell. So they use that. So they wait about a 24 to 72 hour following the injection when most of the agent has now left the normal cells, but they stay in the cancer cells, and then the tumor is exposed to the light. And then that photosynthesizer in the tumor absorbs that light. It produces this active form of oxygen that destroys the nearby cancer cells. Okay? In the next lecture, we'll talk about a few more obstructive lung diseases. We'll focus on aspiration, sleep apnea, obstructive sleep apnea, and asthma.